You're watching the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, teeth in a day. According to my first guest, you could walk in his office with broken down teeth and walk out with a beautiful smile on the same day, oftentimes in just an hour. With us, we have Dr. Sutherland. Dr. Sutherland, welcome to the program.
It's a pleasure to be here.
Now, people can walk in, right? I mean, they've made an appointment over the phone.
Right.
And they have pretty bad teeth.
Right.
And in the same day, you can fit crowns and they walk out and they're done.
Yeah,
That
absolutely.
happens?
Absolutely, every day. And not only crowns, but when we get into the procedures that need more than a crown just to save a tooth, we can fit all of that in usually within a couple hours.
Do you have your own lab?
Yes, yeah. We have our own lab. And most of the dentistry, though, has gone in this digital direction where a lot of it's made without a lab technician on a CAD/CAM computer where we can make the crowns right here in one day.
Now, I haven't seen this firsthand, but in your office, it's like a wand that goes in their mouth.
Yeah, we actually have a computer, and on that computer is a camera. So after we get the tooth ready to go, we go ahead and take a picture of that tooth. We then design the crown right in front of the patient as they're sitting there watching. And once we have it done where it fits into the mouth, we go ahead and send it to a milling machine. It mills a crown out of a tooth-colored block.
And that's in your office?
Yeah, right
this
in the
milling
office.
machine, okay.
In fact, the patients watch it as it's happening. We mill it out, and within about an hour, the tooth is customized and ready to go.
And how soon can they eat and chew and do all that stuff?
They can eat right away. They may be numb for a little while when they go home, but they can eat and chew, and it's completely done when we bond it into their mouth.
What do patients say, by the way? I mean, do they appreciate it?
Oh, absolutely, absolutely. And in fact, I get a lot of patients that come in. In fact, I had one a couple days ago. They've had this crown that's fell off their tooth 2 years ago. And their story is they went to have the crown made. They tried, and the crown didn't fit. And then they had a temporary in their mouth, and the temporary fell out. And then they tried again. And finally, they got frustrated, and they just actually didn't get it fixed. And then they come into the office, and they're really expecting, a lot of the time, the same procedure. They're expecting me and to take 2 weeks to make another crown. And by that time, the tooth's rotted more, and now the tooth needs a root canal as well. And we talk to them about what we can do, and they sit down sometimes that very same day. And we finish the root canal, we make the crown, we glue it in, and it's pretty unbelievable.
Does it cost more to go to a same-day guy like you?
No, most of the time I found it costs less. We have the machine. We're able to mill the units at our office for a lower price. We don't have to pay for a fancy lab. We don't have to pay for shipping costs to send it across town. Things can actually be done in less time. And in our dental offices, our chair time is valuable to everyone. So it all comes down to they actually pay less for a procedure, even though it saves them more time at home and more time away from work.
Okay, good. So what if their mouth is really falling apart? Just a complete mess. Do you ever get those? And those can also be done? Like they walk in with bad teeth and they walk out with a bunch of nice teeth.
Every week we have patients that come in and that they need a lot of things restored, a lot of different types of dentistry done in their mouth. I had a really nice lady come in last week. She needed her lower teeth repaired with crowns. And some of those, when we got in there, need root canals, so we did that and we finished on the same day. Her upper teeth were not savable. So we had already made a pre-made set of teeth for her. We actually pulled out the remaining teeth that weren't savable. We replaced implants in there and put the permanent teeth at that same procedure. We had an anesthesiologist that put her to sleep. She woke up and everything was done. And when we go home, some of those things need to heal. So in those big cases, so we actually end up doing a final restoration a couple months later, but they leave with teeth in those cases that day that they can smile and they look great. We tell them not to do too much on those teeth. Well, the next day she had a big party planned. So she came to me the following week and she told me that, I know you told me, doctor, not to eat on these teeth with anything real hard. She said, but I had this apple tree back in my backyard where this party was. And I went back there and I had to take a bite out of this apple. And so she took a bite, and everything worked out good. She found out she can actually chew something again in her life. And she was so happy when she came back.